I'm Dr. Daniel Kantor, Neurology in Real Time. I'm joined here by Sophie Rowe, who's actually a medical student. She's in her third year at Johns Hopkins University in Baltimore, Maryland. Firstly, congratulations on getting into medical school and in getting into such a prestigious medical school. You're standing in front of a poster, and that poster has to do with something called higher efficacy drugs and has to do with depression. Tell me a little bit more about that.
Okay, so we were interested in studying the effects of the different therapies that are available for MS patients. And there are some drugs that we consider low efficacy and some drugs that we consider high efficacy because they're usually reserved for people who are not responding too well to the low efficacy therapies. And we were interested in how those two different kinds of therapies might have an effect on the depression that a lot of patients with MS suffer from.
We think of these medicines as being proactive medications, prophylactic, preventive, as being disease modifying. We use all these different kinds of terms, but we don't think of them as helping individual symptoms. Yet here you were looking at their effect on an individual symptom, that symptom of depression.
Right. So our driving hypothesis was that depression has an underlying neuroinflammatory component to it. And as you know, multiple sclerosis is an autoinflammatory disease where the body's immune system is attacking the nervous system. So we thought there may be a link between the anti-inflammatory drugs that are used for MS therapies and how they may have an effect on depression that patients suffer from.
Did you find that link?
We may have. This is still in its early stages, but from our results, we found that the higher efficacy therapies, people who are on the higher efficacy therapies, they had a decreased scores in the depression symptom scales, where the people who were on the low efficacy therapies did not have any changes in their depression scores after a year of follow-up.
So aside from higher efficacy drugs having higher efficacy, meaning having higher strength in terms of disease modification, they may actually help with some of the symptoms of MS and one of the important symptoms, which is depression. But once again, if someone is feeling depression, if you're at home and you're feeling sad or you're feeling lonely or you're feeling hopeless, especially if you're feeling like hurting yourself or hurting other people, please seek medical care. You are not alone. There is a rich community all around you of people who are here to support you. This MS journey is not a journey that you take alone. It may feel that way at times, but you don't have to feel that way. I want to thank you so much, Sophie, soon to be Dr. Rowe, for joining us, and I want to thank all of you back home for joining us at Real Time Neurology.